So part B, we'll start with anorexiants. So these are medications that are prescribed to assist in weight reduction and treatment of clinical obesity, but really should only be used for short periods of time due to the cardiovascular problems they can cause. They're not generally abused, but if no other stimulant is available, it can be taken in very high doses for a stimulant-like effect. So decongestants, which would be taken if you have a cold, so they have much lower dependency than other stimulants. They do constrict the blood vessels, thereby relieving nasal and sinus congestion. That's what helps you breathe. Usually found in cold and allergy medications combined with antihistamines. So if extended use, so somebody uses this over a long period of time, so longer than a cold may last, you could risk the effect of cardiovascular disease, heart attack, stroke, and seizures. So these medications can be used to create crystal meth. So these are the kind of medications that would be used in those clandestine laboratories and create crystal meth. And death can occur from overuse of a decongestant. So more rare types of stimulants. So this is cat. So it is a plant native to Africa. And it is similar to amphetamines. So there is increased use in Canada due to Somali refugees and immigrants coming from Africa and bringing it with them. It is a social drug. It's ingested by chewing leaves or brewing tea or smoking it. It does produce energy and a euphoric feeling. There are some health concerns. So it does, like any stimulant, suppresses appetite, prevents sleep, increases respiration, hyperactive behaviors, and it can lead to withdrawal, increases in dopamine and serotonin, just as the other stimulants, and norepinephrine. So heart issues, increase in impotence in men, and can be passed through the breast milk to babies. So shouldn't take cat when you're breastfeeding. It takes about 2 to 3 hours to reach the maximum effect. So it's slow to effect. So again, the slower the time it takes to feel the effect, the lower the physical dependency. So it's not as addictive, but it is still possible to become physically addicted to it. Chronic use, so can cause depression, could have some manic symptoms, could look like schizophrenia and maybe Parkinson's disease, and withdrawal can look like nightmares. So bath salts. This is something you might have heard in the news back in 2012. I think there was a large outbreak in bath salts, especially with people acting very bizarre, very violent. So it is dopamine and norepinephrine reuptake inhibitors. So it's similar to cat, but it's synthetic. So it's man-made and it's more potent. So it is similar to MDMA or ecstasy and PCP, which are hallucinogens. So it has a stimulant and hallucinogenic properties. There are more than 200 types. So this creates quite the significant public health issue because overdoses are quite hard to predict, especially they don't know how much of the drug will cause an overdose because the pharmacology of the substance keeps changing. So every time a new lab creates a new type of bath salts, they're slightly different, so it's hard to predict what will happen to the body if somebody takes it. So the effects look like a combination of methamphetamine and cocaine. So significant addiction potential. So it is, again, similar to cocaine that way. And it can be administered in many, many different ways. The effects last about 6 to 8 hours, so a pretty long time. Starts euphoria, increased physical activity, inability to sleep, you don't want food or water, and of course cravings for the drug. But there can be heart and brain toxicity, erratic behavior, inattention, panic attacks, agitation, paranoia, hallucination, psychosis, self-mutilation, so harming yourself, aggressive, violent, and suicidal actions. Overdose is profound toxicity, so taking an extreme amount. There's a link there I'd like you to take a look at regarding a drug alert from the CCSA back from 2012. But I'd like to pause right now and take a look at that. So betel is another plant, but it's from the South and Southeast Asia. It's used as a mild stimulant and for medicinal properties. It's placed in the mouth like chewing tobacco, so it's kind of absorbed. So it's the 6th most commonly used psychoactive substance in the world. In long-term use, you can get cancerous lesions in the mouth and throat. So on to nicotine. So nicotine, when combined with tobacco, it is the leading cause of premature death of any psychoactive agent in Canada and the world. So again, smoking or chewing tobacco. So it's part of the nightshade family. So nightshade plants include tomato, eggplant, peppers, and also poisonous plants like mandrake, belladonna, and morning glory. And these have hallucinogenic properties. So it is a toxic substance, nicotine. A few drops of pure nicotine on the tongue would kill an adult, but tobacco smoke, there's 500 different compounds in the smoke. So nicotine is a psychoactive agent in tobacco, and it makes it addictive. So just like THC in marijuana is the active ingredient, nicotine is the active ingredient in tobacco. So nicotine increases dopamine in the reward pathway in the brain, and that's why it's so addictive. Nicotine reaches the brain in 8 seconds from inhaling the smoke, so that's significantly fast, and can also be absorbed through the oral and nasal mucous membranes in the mouth and nose, so like chewing tobacco. So nicotine, like any stimulants, increases the heart rate, blood pressure, depresses the spinal reflex, reduces muscle tone, decreases skin temperature, increases acid in the stomach, reduces urine formation, loss of appetite, among many other concerns. Small doses in non-smokers, so somebody who doesn't smoke very often, coughing, nausea, vomiting, dizziness, abdominal discomfort, so you kind of feel nauseous, weakness, and skin flushing. So long-term effects of somebody who smokes for a long period of time. So narrowing or hardening of the blood vessels, increased risk for heart attack and stroke, shortness of breath, respiratory infections, and oxygen deprivation. So it, of course, there's increased risk of cancer. We hear that often. Stomach ulcers, impotence, increased risk of brain hemorrhages, memory loss, COPD, emphysema, MS, risk of thrombosis if taken with birth control pills. So that's one of the warnings on a birth control package, is do not smoke if you're taking these pills. Nicotine crosses the placenta, so if somebody who is pregnant smokes, babies are born smaller, more likely to have premature births, so a baby would be born too soon, greater number of stillbirths, and sudden infant death syndrome, so either the baby's born or dead before it's born, or it dies suddenly after birth, and there's also increased risk of development of ADHD and diabetes in those children. So tolerance develops. So for regular smokers, they become less sensitive to the effects of nicotine, carbon dioxide, and tar, and the tolerance to nausea and dizziness. So after a while of smoking, you don't feel nausea or dizzy anymore. The long-term effects, of course, it shows physical and psychological dependence on cigarettes. Emotional states and environmental events can cause cravings even after abstinence. So, for example, somebody who always smokes after dinner, that would be an environmental event. So psychosocial factors play a role in starting a smoking habit. So friends, peer pressure, family members, they can play a role. So withdrawal, so somebody who's stopped smoking cigarettes can feel anxious, irritable, increase in appetite. And that's why there's a lot of weight gain when somebody stops smoking cigarettes. Mild confusion, emotional depression, difficulty concentrating, anger, sleeping problems, changes in blood pressure and pulse weight. So the weight gain. So nicotine, it also suppresses leptin, which is a hormone that controls appetite. So when you stop smoking, the leptin increases, which causes an increase in appetite and causes a weight gain. So here are many different websites that look at tobacco and quitting smoking, some information about smoking during pregnancy, also specific to older adults and smoking, some information around that specifically, and also looking at Stats Canada in 2016 and how many people in Canada are smoking. So take some time to review these, so I like to pause the voiceover and look at those. So smokeless tobacco, so that's chewing tobacco. So some effects that happen: so loss of taste because you have it in your mouth for so long, discoloration of teeth, damage to teeth and gums, gum disease, loss of teeth, and risk of heart attack and stroke. So studies found that cigarettes were more difficult to quit than other substances. Secondhand smoke. So if you live with somebody who smokes and they smoke in the house, you could be experiencing secondhand smoke. So environmental smoke has more contaminants than mainstream smoke, so somebody who's actually inhaling off the cigarette. So there's increased risk of lung cancer, dementia, breast cancer, and Alzheimer's disease. But nicotine can be used for medicinal uses. It's been used to combat against Alzheimer's disease, Tourette syndrome, Parkinson's disease, arthritis, calm hyperactive children, and relieve some anxiety disorders. So this is not smoking the nicotine, this is a medication. So moving to caffeine. Caffeine is a stimulant, and it's the most used psychoactive drug in the world. It leads to an increase in firing of dopamine in the reward pathway of the brain. So it reaches all the body tissues within 5 minutes of drinking that cup of coffee or whatever kind of caffeine you're having, and a peak level is in about 30 minutes. So there are medical uses, so combating migraines, so you get caffeine pills to stop a migraine, emergency bronchodilator for asthma, so it is something to help with somebody who's having an asthma attack. It's also a substitute for methylphenidate, which is Ritalin. Can treat skin disorders, enhance sperm mobility, and it's a mild stimulant. So moderate doses, this is about 2 cups of coffee. So it's similar effects to amphetamine. So it's a mild mood elevator, enhancing energy, increase alertness, postpone fatigue, so keep you awake, and impair fine motor performance, so you can't get shaky hands. Increase in motor activity, alter sleep patterns. So if you drink caffeine too close to bed, it might stop you from sleeping. Diminishes how much time you sleep, and it changes your REM patterns. So again, you shouldn't drink coffee within 10 hours of going to bed. So if you go to bed at 10 p.m., you shouldn't have any more after 12 o'clock. Increase your respiration, blood pressure, and metabolism. So caffeineism. So this is caused by high doses of caffeine. So irritable, anxiety, restless, headache, rapid breathing, tremors, increased sensitivity, light flashes, tinnitus, so that's ringing in the ears, gastrointestinal upset, so causing some tummy problems, rapid irregular heartbeat, or disrupted sleep. So chronic long-term misuse, so it can cause ulcers, anxiety, increased cholesterol, and depression. 3 or more cups a day is related to bone loss in older women, so it's actually related to an osteoporosis. High levels of consumption. When caffeine passes through the placenta, the fetus can have heart rhythm changes. So should keep caffeine intake to a minimum when pregnant. Symptoms happen with less caffeine as a person gets older. So as you age, it won't take as much to have the effects of caffeine, so you should drink less as you get older. Intolerance, especially to cardiovascular effects, so your heart won't be beating irregularly as you become more of a chronic user. And there is a physical dependence and a mild psychological dependence. So for example, somebody who gets up in the morning, they reach right for that pot of coffee because you feel like you have that morning coffee habit. So some withdrawal, severe headaches. So if you don't have coffee, you can have a severe headache, feel irritable, lethargic, anxious, fatigued, and this can begin between 3 and 48 hours after the last cup of coffee or caffeine you've had. Overdose. If you have 40 strong cups of coffee in a very short space of time, that can be very dangerous for children, and this is also related to hospitalization due to large quantities of energy and caffeine pills. So when we say caffeine, we're not just talking about coffee, we're also talking about energy drinks, caffeine pills. So there's some information here from Eat Right Ontario, which is dietitians, and it's looking at facts on energy drinks. There's also information in the next link regarding alcohol and caffeine, so it's combining a depressant and a stimulant. So I'd like you to read over both of these links and get some more detailed information about those two issues.